Hi, I'm Dr. Michael Vachon with Center for Performance Medicine and Rehabilitation. You know what? We just had a power outage. We're back. We were supposed to start at 10. We were on for about 15, 20 minutes, and boom, the power went out. I don't know what's going on. It's a beautiful day outside. This is crazy. But you know what? They can't get us down. We are back, and we are going to do it today. So today we are going to be talking about protecting the arm in baseball and softball. Going on my 22 years of practice, I have seen a lot of change in athletes, a lot of change in softball players and baseball players. The level of performance that we see today is incredible. We see athletes stronger, faster, can throw a ball harder, can hit a ball longer, all these amazing things that we didn't see before. We're seeing the level of training and the level of practice and the level of play increase dramatically, even 10 to 15 years ago in comparison. So with all those demands on the body, we're seeing great play, but with all those demands on the body, we're also seeing more injury. And that's where I come in. How can I help you not only feel better, be better, but perform better? So today we're going to be talking about powerful pitching. We're going to get into the baseball aspect of pitching first, and then we're going to finish it up with the softball aspect of it. But what an amazing thing is when you're dealing with the hips, there's a lot of similarities, even though the mechanics of pitching a softball, fast pitch, compares it to an overhand pitch with a baseball is much different. But the hips play a very similar role. So overhanding pitch one is the fastest, one of the fastest motions known to man. It is incredible. People are throwing so hard these days. There's a statistic based on 2008, 2009, how many MLB players are actually pitching 94 miles an hour or greater. Back then there was about 8,000. They say in 2018 we're going to see over 20,000 pitches that are over 94 miles an hour. So again, these players are getting stronger, faster, more powerful. And they're really starting to unveil the understanding of how the hips play such an important role in pitching. We have done a lot of research focusing on the glenohumeral joint and how the scapula, which is the shoulder blade mechanism, actually comes into play. I actually have a model of that. So you have the scapula, this is what's called the glenohumeral joint. It doesn't move like this, okay? This is for examples. And we've done a lot of research to understand how that actually pertains to the velocity to a pitching an overhand pitch. But now the research is starting to focus on the hips and starting to understand how important of a role that they actually play. It places an enormous force on the upper extremity when you're pitching. So as we're going to be getting into proper hip mechanics, proper hip alignment, proper strength and flexibility are very telltale signs that we look for in our office to be able to judge and know exactly how to help you. It's a force of nature, right? I mean, they had actually a demonstration where they were having major leaguers trying to hit the windmill softball fast pitch. And you know what? They said it was harder than hitting a baseball. Can you imagine? The distance is actually closer to the mound, and even though it's moving only at 55 miles an hour, because of that distance, it's actually moving quicker, and the reaction time actually has to be faster. So that softball generates similar forces that we see across the shoulder that we see with an overhand pitch. And those biomechanics are starting to reveal that they can cause stress and strain on those structures as well, just like we have noticed and revealed with the overhand pitch. So that biomechanics is very, very important. Fast pitch softball has similar injury risks that we're starting to see with overhand pitching. I mean, you know that fast pitch softball, they can pitch after game after game after game, but it is still an overuse injury that we're starting to see happen. And again, we're starting to understand how the hips play an important role in that pitching mechanic. So let's look at the mechanics of those two, pitching, and they are definitely different. Now, I'm not going to get into all the mechanics of that. I'm going to mostly focus on the hips. I'm going to focus on a smaller portion of the hips because I could do an hour or 2 hour conversation just on overhand baseball mechanics and fast pitch softball windmill mechanics. So, hips don't lie. Proper mechanics of pitching. Use hips rather than just relying on the arm for the power. I see so many kids at a little league level that is just kind of going the motions through the bottom here, not really worried about getting their hips into action, and they're all arm. And some of them can actually throw really, really hard. But some of these habits that are being created when they're small, when they're in that little league range, are going to follow them all the way to if they even make the pros. So the foundation of what you are putting together and the mechanics and the strength and the flexibility is so important early on. Hip motion is essential in pitching component. Should show more internal rotation. I'm going to talk about this in the stance position or the stance hip or leg. And then we're going to talk about the external rotation that actually occurs in the stride or stride hip, stride leg. So I'm a right-hander. So this is a stance from the stretch. So I'm going to be in right-handing throwing position. My stance leg is going to be my right leg, and my stride leg is going to be my left leg. Okay? So this is what's going to be on the mound. And then as I'm going through that motion and I'm coming through and I'm stepping, this hip is internally rotating and this hip right here is externally rotating. As we're also seeing that foot point straight ahead at the home plate. Okay? Very, very important. We're actually going to talk about why that's important. But what they're finding out through research is there is actually a ratio that they're coming up between this internal and external rotation and what is ideal for pitching. Some of the research is still out on that, but they're saying that there's really the basic importance is strength, flexibility, and proper biomechanics. That means proper body positioning of the hips, of the pelvis, and of the lower back. So as you can see, that kinetic energy, which we're going to be explaining more about, produced by the hips, the pelvic motion directly affects the velocity of the ball and is extremely important in saving that arm. Pitchers have been shown to have decreased hip abduction. So abduction means you're taking the leg away from the body. Okay, adduction is you're bringing it towards. So as you're taking the legs away from the body is where you get that abduction that we're talking about. So less strength and less internal rotation that's occurring as well in that stance position. Now I've also seen with baseball players is in that stride leg, they have trouble either they're pointing too far out or they're pointing either to first or third when they're supposed to be going right towards the catcher or home plate. And that has a lot to do with that external rotation that we can see as well. So the throwing motion is very complex. Again, I could get into a whole talk just about that. It begins with the energy, though, that is generated through the hips, just like in hitting. We focus so much on hitting, the importance of the hips and the motion of the hips in the hitting and how it contacts the bat, and that's where our power comes. Well, we're seeing the same thing with the hips when we're dealing with pitching as well. Abnormal motion can lead to a disruption in this kinematic chain or kinetic chain. Now, it's important to understand, especially with little leaguers, you guys are growing. You're going through these dynamic growth spurts. And when your body grows, it actually grows explosively. That means your bones and your skeletal structure grows first. Then your muscles, tendons, ligaments, and your brain has to catch up with all of this growth. So we do see that with athletes in here. All of a sudden, one year they're having an incredible year of pitching. Then all of a sudden their pitching just falls off. Their power falls off, their accuracy falls off. Well, many times it's through those growth spurts, those adolescent years, that they actually need what's called neuromuscular re-education. They need to focus on flexibility and re-strengthening as the body gets familiar with this new body. Because think about it. With that throwing motion, now it's throwing with a longer arm, longer legs, wider hips. So the body is used to shorter arms, shorter legs, and smaller hips. So it's a re-education process that actually has to occur. You see that all the time. So that kinetic chain that we're talking about, okay, it's actually an engineering concept. And it is very true in the understanding of how the entire spine, pelvis, and hips can have an effect on that throwing arm up here. If you can imagine that these individual segments all put together like a bicycle chain, and one affects the motion of the one above and below it. And if there is a change in that link, or if there is an imbalance, just imagine if a person has an imbalance. Look at the curvature, look at the change that it's causing in the hips. What is it doing up here? What is it doing to that throwing arm? So if I show you on myself, if I'm pitching and I'm perfectly aligned, okay, am I going to have a more likelihood to throw a more accurate ball? Is it going to be more powerful because my muscles are going to be working in symmetry instead of asymmetry? What do you think? You're right, most definitely. But if you're dealing with a body that you have one shoulder that's higher than the other, one hip that's higher than the other, that's possibly caused because of an imbalance that you see in the hips or the lumbar spine, or even in the upper thoracics, sometimes even in the neck, but mostly in this area. Do you think that'll affect your pitching? Are you one of those people that are struggling with that and can't figure it out? Well, that's one thing that we do in here is we look for those things from a biomechanical standpoint to be able to measure those imbalances and see how they may be affecting you. And that's where those individual segments, those joints all working together can affect what's happening down here, can actually affect what's actually happening up here. And that's how the hips can play such an important role in the movement or motion of the shoulder. If the kinetic chain is disrupted in pitchers, it can cause an increased force through the shoulder. How many of you are hurting after pitching? Oh, my shoulder hurts. Oh, I have tight chest. Oh, my back's hurting. What's going on? Okay? This can cause also a decrease in velocity, decrease in accuracy, can lead to an injury either in the lower extremity. Many times we see in the hips what's called an impingement injury, or a groin strain or sprain is very typical, or even a rotator cuff or shoulder injury, sometimes a labral injury. I've had retired professional baseball players not realize all the problems that were happening below, and they said it really would have actually lengthened their careers. So that's incredible, and it makes so much sense, and they can put that together. And they always said, why didn't anybody tell me this? How didn't I know this? Well, that's what we do here. We look at you from head to toe. We don't look just at the motion of your arm. We don't look just the motion of your elbow. We're also going to be looking at your hips as well. And I hope you understand how important that is. That external rotation of that stride hip or leg is critical in the proper positioning of that first foot, the follow through. See how it's pointing right towards home plate? Very, very important. And actually follows through as the torso and upper extremity are rotating. Rotating, okay? Think about it. Internal rotation, external rotation. Look what it's doing up here. Without even any arm motion. Okay? Without any arm motion, what's happening? It's bringing that ball forward, correct? Right. Can you imagine if you couldn't move your hips like you needed to? Maybe the ball would release out here. Maybe the ball would release out here. Maybe it would release back here. How many of you are struggling with that? How many coaches out there don't understand why their ball players are not getting the accuracy down? Okay? Look to the hips. The stride foot needs to land with the toes pointed towards home plate. Not the foot should be pointed either to first or third. Okay? Should be straight ahead. Again, some of that is practice, And some of that sometimes is an imbalance in the hips that's causing that not to happen. The stride foot needs to land with the toes pointed towards home plate. Keep the pitcher's kinetic injury going downhill towards the plate. We know all that importance of that follow through when we're pitching in baseball. Abnormal hip rotation can lead to breakdown in that kinetic chain. So again, hip rotation they're talking about. So let's say one's hip rotated forward, the other one's rotated back. That's going to affect the mechanics or the movability of these internal and external rotation of these hips. Could throw that ratio off, which causes you to have less velocity and affect the accuracy of your pitching. Why is this important? Well, because the lumbar spine, the pelvis, and the hips plays a significant role in the motion of that shoulder. If the foot rotation is wrong, the energy transfer from the hips to the upper body actually decreases, causing a decrease in rotation and velocity of that ball. So again, in review, we're talking about changes that we're actually making in the hips that are actually changing the motion of what's happening in this shoulder and actually decreasing that velocity, decreasing the ability to make that hard, accurate throw that you're looking for. Also, it's important to look at the strength of the hips, especially the abductor muscles. Remember we were talking about abductor, meaning the muscles that bring your leg away from you, that's in your hip. Those are specifically the glute medius and the glute minimus. They decrease the lower extremity flexibility and can cause an increase in shoulder load and is likelihood of injury because of the breakdown, again, in that kinetic chain. Similar hip issues may contribute to the likelihood of injury in softball. When it comes to the hips, even though the mechanics are different, it is very similar in the same flexibility, the same hip biomechanics, the same strength, and the same abnormalities in the hip can cause the same decrease in any throwing velocity and accuracy. The unique underhanded throw is part of that windmill fast softball pitch that we see. It requires both coordination, good range of motion of the upper and lower extremity. Okay? So, how flexible are you in your hip flexors? How flexible are you in your piriformis or your glute muscles? What is that? Well, that's actually a muscle in your bottom here, okay? It's a deeper muscle. How about your hamstrings? How about your quads? Have you thought of any of that? I know you guys spend hours throwing. Keep throwing. I challenge you, what are your hips doing? What are your hips doing? Because remember, with continual throwing, that sometimes can create also overuse injuries. Not saying that throwing isn't important and practice isn't important, but if you're in that frustrating position as a fast-pitch softball player, it's something to look at. Especially a female's mechanics compared to a male's mechanics is different. You have a different shaped pelvis, okay? You have what's called a different type of Q angle, which is the distance between the hip and the knee. And it causes greater development of the outer part of the quad and the middle part of the quad compared to the inner part of the quad that can have an effect on that ab and adduction that we were talking about. So, like we had said also, a lot of this is the same. Proper conditioning of the lumbar, pelvis, and hip complex with strength and conditioning work, especially in those glute muscles like we were talking about. Make sure that the pinching arm movement follows the rotation of the trunk. Okay? You're taking that back swing and then you're coming through it. Okay? Make sure that it follows that motion of that trunk. The back swing begins as the pitching arm moves backwards and includes that flexion or bending forward of the trunk. That can have an effect on these hip flexor muscles. That can also have an effect on these back extensor muscles as well, as far as flexibility and strength. Hip needs to rotate to a closed position towards home plate during that delivery. Very important. Forcing the back leg to drive and help, okay, with that movement as you're coming through. You're using that back leg, and it doesn't matter if that back leg is touching. Okay, it comes off the ground, it's fine. Full trunk rotation will significantly transfer that momentum, okay, of that pitching arm. Now, do you hear trunk? Well, what does that mean? We're talking about all through here. I'm going through the mechanics that you probably know better than I do, because you do it. But when they say trunk, 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 they're talking about the hips, the pelvis, and that lumbar spine. Just want you to remember, it's not like the trunk in your car, okay? No weight on the back of the foot at all. Foot can even be off the ground. Hips can be fully rotated and squared in front of that plate. Okay, so you want to be square to that plate. All right? Really? That much hip rotation? Yes. Yes. If not, the arm experiences shoulder, what's called abduction across the body, okay, rather than that nice shoulder flexion, and it forces the pitcher to throw across the body, okay, missing out on the help from the trunks. So instead of your momentum moving straight forward, it's moving across for you. How's that going to help you for your accuracy? It's going to mess you up, right? So not only is it going to mess up your speed and your power, it's going to mess up your accuracy as well. So, baseball soft pitch, baseball overhanded pitch, and that windmill pitch of softball. Do you think the hips matter? I hope I've changed your mind. I hope I've made you think of something. Pitching comes from the body, not just the arm. I know we focus on that glenohumeral joint, that shoulder joint. I know people have Tommy John surgery. Wait a minute, Dr. Sean, come on, are you telling me that? No, I'm not telling you that. But if you don't take a look at this, if you don't get this checked out, you're missing a great opportunity, because this is your power center. Your trunk, that lumbosacral, the hips, the pelvis, that is your power center. Hips may be as vital as the arm in pitching. Yes. Try to pitch without your hips. First of all, you're not going to be able to stand, right? Okay? I know you'd probably say, wait a minute, how am I going to pitch without my arm? I get it, but it's just as important. Softball and baseball, the hips matter, people. Is your spine properly aligned? Remember we had talked about the imbalance in the spine and how that can throw you off? Is your pelvis properly aligned, or your hips properly aligned? That is really what taps into the power of your pitch. Also, are the muscles strengthened properly? Do you have the flexibility in the right places? Okay? That's one thing that we look at when you come into the office, is we're evaluating these things. We're looking for those areas of weakness. We're looking for those areas of tightness. And we're looking for the abnormal biomechanics or imbalance that you may have in that kinetic chain. So are you a person out there that is still having trouble? Are you dealing with issues that your coaches don't seem to fix? And you're like, wait a minute, I don't really have an injury, nothing really hurts. But man, I've gone through a growth spurt and all of a sudden now I can't pitch. Or I started out pitching really good and it's almost like I forgot it. Or you know what? I never really was able to, but I always felt that I could. Well, give us a call. We treat all ages, all athletes. And today we focused on the baseball and softball pitching. And I hope that you learned that the mechanics of those two around the hip, the flexibility, the strength, the awareness, the proper alignment can have an effect not only on your performance, but also can prevent injury. And if you are injured, then what has happened to cause those hips to actually become imbalanced? Has anybody told you that? Thank you for listening today. Sorry about the crazy blackout, but we are back. We are here. I'm Dr. Michael Vachon with the Center of Performance Medicine and Rehabilitation. My partner is Dr. Catherine Doty. Please come in and have a consultation. You can see it. You can actually go on the web, go to www.gethealthystl.com. Thank you and have a great day.